Okay. Hello, guys. It is good to see everybody. We are going live to discuss some breaking news. You guys have probably heard the headlines, of course. We've been talking about it for the last few days. This is the idea of the updated COVID booster for the fall. I wanted to sort of let you guys know what the data shows, what we're seeing. It has now been approved, as you all know, for COVID boosters, COVID vaccines, any vaccine, honestly, to be approved. It goes through a number of different steps. The FDA has to approve it. The ACIP, that's a CDC committee, they have to approve it. Then CDC director has to approve it. There are steps before that. There's obviously studies and research that goes into this. So let's break down what we are seeing on the news, what you're reading, the articles that you're reading, etc. So you know what is going on. By the way, my patients have been asking, and by the way, any of my patients who are watching and listening, it is good to see you. But I've been getting calls for the last couple of days about, hey, when is the booster coming out? Who's the booster for? Can I get it? So let's talk about it. All right. So the news is we've got an updated COVID booster. Okay, why do we need an updated COVID booster? Well, it's to cover the strains that we are now currently seeing in the environment. The strains we're seeing now are different than the strains that we saw at the very beginning of the pandemic. Okay, so we are this COVID booster is pretty much covering the Omicron XBB dot 1.5 strain, but that includes kind of like the Eris. I did a short video on that. The EG.5 strain, the BA.2.86 strain, the one with a lot of mutations. Anyway, you don't need to know all the names specifically, but just know that this updated booster has been formulated to cover many of the strains that we are seeing now. That is the purpose of a booster. Well, one of the purposes, which is to sort of give additional protection, et cetera, to boost the immune system. But in this case, in addition, it is to provide coverage for strains that we did not need coverage for before. Okay. The good news is that the data we have suggests that the updated boosters we have should cover these strains that we're seeing in the environment. Now, which boosters are available? Which vaccines, you're wondering, probably are out there? We have Moderna and we have Pfizer. Okay. Now, Novavax is still something in the works. That is a vaccine and that has not necessarily been given the approval at this point, but that is something that we may see down the line. Okay. But right now it's Moderna and it's Pfizer. And I know you're saying, okay, who can get a booster? People who are recommended to get boosters, according to the CDC director and the different committees, is people over the age of 6 months, 6 months and older. Now, how many you need and the timing and all this stuff really depends on how many you've gotten before and your age and all that. Your doctor will work with you with that. But 6 months of age and up. And what we're seeing is this is what we call like a universal recommendation, meaning, when we were talking about who the booster would be for, who would get the booster. Some people said, oh, maybe it's only going to be recommended for high risk people over the age of 65. Some people said, oh, it's going to be for this group. Well, the CDC kind of came out and was like, 6 months and older, go at it. Go get it. Okay. So that's sort of a wide sort of swath of people that is recommended to get it. There are some caveats with that. If you have not gotten a vaccine in the last 2 months, you can receive one. If you've recently had COVID, you'll want to talk to your doctor. Like there are some particular situations that need to be accounted for. So whether you can get one right now really depends on the last time you got a vaccine, if you've had COVID recently, yada, yada, blah, blah, blah. But as a general note, 6 months of age and older. Now, then Pfizer, Moderna, et cetera. You're probably saying, well, do I need it? Why would I get it? Is it important? Blah, blah, blah. You know me. Okay. I believe in these vaccines. I believe in vaccines, period. Look, I'm going to get it as soon as I can. As soon as my office gets it in, and I'm going to actually be checking very soon, probably this evening. I'm not in private practice. I work for Rowan University. I'm going to see when our vaccines are in. They might be all right. Well, no, they're not. It was just approved. So well, I don't know. I've got to check to see. But the point being is, you say why? The reason why is because the COVID vaccines, the boosters, they lower our risk for hospitalization and death from COVID if we are to become ill. Really, really important. As you guys know, my mother is recovering from breast cancer. Both of my parents are over the age of 70, over the age of 65 as a threshold, right? They are high risk. If you are high risk, if you live with older folks, if you have underlying conditions yourself, young kids, et cetera, there are certain people that are at higher risk. But what it does is these vaccines lower the risk of hospitalization and death for everyone. But of course, that's particularly important for those people who are at high risk. I am going to get this booster, okay? And I'm going to recommend it to my patients. So that's one of the things that it does, that if you get COVID, your chances of dying from it, your chances of being hospitalized from COVID are less than if you didn't get the vaccine. That is a big, important reason to get it, okay? The next thing is it also decreases your risk of suffering from long COVID if you are to get COVID or have gotten COVID. Really important there because we're learning more and more about long COVID. These are the sort of the symptoms that people get, even that retain and that remain even after having recovered from acute COVID illness. Sometimes it's pretty devastating for a lot of people. Okay, so I know the sun is sort of glaring in, but yes, it potentially reduces the risk of suffering from long COVID, and there are other benefits as well, guys. The way I'm thinking about it personally is, this is probably going to be something that we're going to have maybe yearly or at some frequency. I'm okay with that. We've got flu shots yearly. There are other vaccines that we need to get boosted. That does not worry me at all, especially if it's going to increase my chances of staying safe and keeping other people safe. Okay. All righty. Now you're probably wondering, okay, well, where can I get this COVID vaccine? Because like the emergency declarations about COVID that we had during COVID are gone. But for many people, if you've got insurance, you still, for the most part, should be able to get the vaccine. It should be covered. If you don't have insurance, you should be able to get it from your local health department. Okay. So you should probably be able to get it from your local health department. For children, there's vaccines for kids that it's covered under. Also, there are the Bridge Access program that's affiliated, pharmacies are affiliated with it, that help people get access to this COVID booster. So keep in mind that there are different ways to get this COVID booster, even if you don't have insurance. I would first start with your local health department, okay, if you're not insured. This is the thing. A couple of you guys are writing in and asking, can you get the COVID vaccine and the flu shot at the same time? Yes, you can. Okay. You're asking if this will be a yearly thing like the flu. It very well may be. It wouldn't surprise me if that were the case. A lot of you are writing in, and I love this, that you're saying you're going to get the COVID booster. Please write in the comments. Are you going to get the COVID booster? Some of you have written that you're not going to get the booster. Now, of course, it's always your choice. Okay. Right. You always have agency over your body. Understand the risks and the benefits. And these vaccines are to keep us safe. Just like I recommend pneumonia vaccines for certain people at certain ages, the shingles vaccine for certain people, certain ages. This, to me, is falling into the category of the vaccines, this sort of armamentarium of vaccines that we have that we recommend to people to keep us safe. Okay. So yeah, write in the comments. Let me know what you plan to do. Questions about this, you really talk to your doctor. I mean, I'm fielding questions already, have been the last couple of days about the COVID booster. A lot of patients I saw today even were asking about it. So I know people are interested in it. I'm so glad. I understand there is COVID vaccine fatigue. There is COVID fatigue. A lot of you are saying, I'm done. I'm so tired of this. I don't want to see it. I don't want to hear it. I understand that. But I do want you to consider that even though we're tired of it, doesn't actually mean it's tired of us. I know we don't want to see it or think about it, and we wish that it had turned out better. I understand that. Look, the first round of vaccines, many of us made it sound like, even doctors, I don't know that I ever thought that we would need this many vaccines, or that we would need to keep getting them, or that we would still have infection rates. I'm not sure that anyone predicted that. So if you're frustrated, I get you. I hear you. But that doesn't change the reality of the situation that we're in. The reality of the situation that we're in is that people still die more from COVID than they do, say, of a cold, of the flu. It's still quite deadly for many people, and it can still harm many people. So this is the thing. I just want you to be very thoughtful. The vaccines really should be, some people may be able to get back the vaccines, the boosters, as soon as tomorrow. So check with your healthcare provider, check with your local pharmacies and things like that. But this is the thing, vaccines really do save lives, and this is the case as well. I just wanted to give you guys a very sort of short spiel on the COVID booster, and just give you an idea of what's going on. Okay. I think this is a really important landmark. This is important timing too, as we come into fall. We know right now that hospitalizations and COVID cases are increasing. They're not the level at what they were like at the height of COVID, when things were like, woo, 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 like really, really out of control. But honestly, in my opinion, they're still out of control because we have more people getting sick from COVID and dying from it than we want. Okay. So that is still very much a reality. And COVID cases and hospitalizations are on the upswing. So with that, some of you are writing in and saying, should we wear masks, etc. There are many situations like I'm wearing a mask in the office. I never stop wearing a mask in the office though. But the other thing is, look, traveling and being in crowded spaces, you need to be careful because COVID cases are increasing. And I know many of us right now know someone or know of someone who's gotten COVID or has COVID or getting over COVID. Okay, that's what's happening. So please sort of keep that in mind. Understand your risk. Understand if you live with people who are at high risk. I hope this is helpful, guys. Once again, write in the comments what you're going to be, what you're planning to do. If you're not sure, that's okay. Remember to talk to your doctor. Talk to the people you trust, not the internet. Okay, but your doctor who can really give you a sort of an assessment of your risk, etc. Okay, and just know again, if you're frustrated, I don't blame you. I don't blame you. But our frustration, and I say collectively, our frustration doesn't change the fact that COVID is still here and we still need to protect ourselves and others from it. Okay. Guys, I hope this is helpful. Let me know right in the comments. Okay. For those of you who are watching on different platforms, let me know what you think. Let me know what you plan to do. If you have COVID now, let us know so we can send up a little prayer for you, send you good vibes, and wish you a speedy recovery. Guys, I'm Dr. Jen. It's good to see you. You guys know I do daily videos and all sorts of stuff. You know that, COVID and everything. If you've not liked and followed my page on Facebook, please do. And for those of you who are watching on YouTube, hello, my YouTubers. Please subscribe to my channel if you haven't. Click the little bell for updates. I do have exclusive subscription groups on YouTube, Facebook, and Instagram where I do private lives. We usually do those on Wednesdays. So you can get like fireside chats. And actually, this will be talked about during this week's live. We'll be talking about this offline. So if you want to join us, make sure you join those groups. Also, I'm on TikTok, Instagram, everywhere, y'all, everywhere. Dr. Jen Caudle. I love you guys. Keep you updated. Stay well.